With OCD, one very important thing is you psychoeducate your client, and this is only if it is only OCD. Okay, if there is comorbidity, like say OCD plus personality disorder, then I'm not sure like how much of psychoeducation will actually help. You should and you can, but how much of it I do not know. With OCD, if it is only OCD, yes, you should be psychoeducating your client. You should be psychoeducating the family if possible, because the caregivers go through a lot when they're dealing with someone with OCD. All right. And what we basically do here is cognitive restructuring. All right. Now, what you need to understand with OCD, obsessive compulsive disorder, is one, at the base, at the root, the issue is anxiety. And most of the times, okay, most of the times, if not always, this anxiety is death anxiety. This death anxiety either can be my own death, or it can be death of some close one. So say my family members. So this anxiety could be about that. So this is the root cause of OCD. Now what happens? There are these situations where there is no threat, but still they start feeling anxious. And once they start feeling anxious, it makes them feel very restless and they want to stop it. In an attempt to stop that anxiety, they indulge in compulsive behaviors, or it could also be compulsive thoughts. So not necessarily they will be always washing the hands. Okay, so there are types of OCDs, out of which one is cleaning, where they are washing or say they're cleaning the house again and again. That is one of them. Contamination is what we call it as. But then there are four more which we are talking about when we talk about OCD. So it can also be about putting things in order. It can be about checking. It can also be just thoughts. So there would be people who are just simply thinking, and then they're like, no, I don't want to think this. I don't want to think. So what is happening here is they're thinking, and these are compulsive thoughts now. So compulsions can be in the form of behaviors. They can also be in the form of thoughts. All right. One amazing technique that we use of like a CBT tool that we use for OCD. One is, again, here also we have a record sheet. Okay, record sheet for their thoughts. What we are doing here is, one, you're asking your client, where were you when this episode was happening, or say what were you doing exactly. So they will be narrating an incident from the past where they had this urge to do a compulsive act to reduce that obsession or to reduce that anxiety. So what were they doing at that time? Also the feeling that you were experiencing, it is anxiety. So how much was that anxiety? How much was the strength of that anxiety? What were the negative thoughts that you were experiencing? And now here comes an important fact. With OCD, the thoughts that they are having, they are of course not supported by proof, right? I have a client who has this constant thought that electricity current passes through his medicines. Now this is the this is the thought that he has. What I have to ask him every time is, what is the proof that the current is going through your medicine? It is very easy for them to say like, yeah, there is no proof, but how do I stop myself from thinking in this way? And rather, when I am in grasp of that OCD, like that entire say the anxiety attack which happens in that given moment, I just forget all this, like the facts and everything. So for such individuals, always ask them to just put this on paper and stick it wherever they feel that this kind of episode happens more often. So say if there is a shoe rack in the house, and every time I look at the shoes, I remember, oh, I have to go and wash my hands. If this is what is happening, place that paper just above your shoe rack, which and where you will be writing what is the proof that the thought that I'm experiencing is true. Okay, so this is how you go about the what are the evidences supporting my thought. And I'm also going to write about the evidences that are not supporting the thought that I'm having. Again, you have alternative thought, the way we were doing in our the log, CBT log. And then again, we are going to write about the emotion of feeling, the strength of this emotion after we replace the thought.